So today we're going to talk about cats with chronic kidney disease and focus on what's really important in dietary management. Before we start that, I need to introduce a few concepts that come from the International Renal Interest Society, or IRIS. This is a group of well-known and well-respected veterinary nephrologists from around the globe. And they have put together both a staging system for chronic kidney disease and, based on that staging system, guidelines for treatment, including some guidelines for nutritional care. So I want to introduce these guidelines because we will talk about those a little bit during the talk. Now, I want to emphasize that the guidelines, or more specifically, the values of serum creatinine and SDMA, are based on repeated measures from stabilized hydrated cats. And that's very important because a single test could give you an indication of renal dysfunction, but to confirm a diagnosis, it does require repeated measures from fully hydrated cats. And remember that cats that are in stage 1 and early stage 2, or 2A, are typically asymptomatic. We don't start to see clinical signs until at least 2B or even stage 3. So these are the stages that the IRIS group has put together. And as I mentioned, we will allude to those as we talk today. But focusing specifically on cats, cats are different from dogs in terms of their renal pathology. They typically have tubulointerstitial fibrosis and not glomerular disease, which separates them from dogs and also may impact what's important in terms of therapeutic or dietary management. Also, cats typically have slow progression of their disease. If they are diagnosed at stage 2B or earlier, they can live many years after that diagnosis, as many as 8 years in one study. So we have to think about how are we going to manage these cats for the long term. The other thing about this condition is it affects predominantly older cats. About 1 in 3 cats over 10 years of age will have some degree of chronic kidney disease. And, cats that are older with chronic kidney disease can still live for several years. We have to keep that in mind as we're thinking about diet. What is the primary function of the kidney, and therefore what function is lost in the face of kidney disease? Well, it really comes down to maintaining balance, whether that's body fluid volume, osmolality, electrolyte balance, acid-base balance, regulation of blood pressure, so many things, but it just comes down to maintaining balance. And so a loss of function can interfere with that balance. The function of the diet in chronic kidney disease is in part to help those malfunctioning kidneys to maintain the balance by altering the amount of fluids and electrolytes and acid base and potential waste products and so forth. But the other important function of the diet is to maintain nutritional adequacy for the cat, maintain body weight, lean body mass, and provide all of the nutrients that a cat with kidney disease is going to need for the many years that they may survive with that. So let's focus on the key nutrients and the evidence supporting each one. First, and probably most important, is phosphorus. It's well known that elevated serum phosphate is common in advanced chronic kidney disease, and it's associated with increased mortality in kidney disease patients. In humans, even within the normal range, higher serum phosphate is associated with increased risk for renal damage. And even though we don't see alterations in serum phosphate early in kidney disease, phosphate metabolism is actually disrupted early in kidney disease, but homeostatic mechanisms continue to function early on. And because of these homeostatic mechanisms, serum phosphate is poorly correlated with dietary phosphate. So if we think about phosphorus homeostasis, there's several players that are involved. Parathyroid hormone, of course, from the parathyroid glands, fibroblast growth factor, or FGF23, 125 dihydroxyvitamin D3, or the active vitamin D3, and renal alpha klothos, which is the cofactor that activates FGF23. Not only various players involved, but various organs are involved as well. The intestines can regulate how much phosphate is taken up or not from the dietary source from the intestines. The parathyroid gland, of course, secretes the PTH. The bones function to either absorb or release phosphorus and calcium as needed to maintain extracellular phosphate. And the kidneys, of course, the kidneys are the primary organ that secretes excess phosphate, and that's under the control of PTH as well as the FGF23 and its cofactor alpha klothos. So as kidney disease advances and serum phosphate increases and the homeostatic players, especially PTH and FGF23, increase, that leads to a large number of adverse problems in chronic kidney disease, such as vascular calcification, which can have an impact on blood pressure as well as renal blood flow. It can have direct cell toxicity. It can contribute to oxidative stress and inflammation. It can contribute to abnormal bone with excess calcium and phosphate being leached from the bone, contributing to secondary hyperparathyroidism. It can even contribute to renal anemia, immune dysfunction, and ultimately to end-stage kidney disease. So controlling for phosphate is absolutely critical. There are multiple studies in multiple species that show a reduction of serum phosphate in the face of chronic kidney disease is beneficial. In cats, there's only a single study, but it also showed a benefit from reducing serum phosphate and reducing dietary phosphate. In that case, it was a study with 1.56 versus 0.42% phosphate, dietary phosphate on a dry matter basis. And in that study, both serum PTH and serum phosphate were reduced, and there was far less histologic damage to the kidneys in the cats fed the low phosphorus diet. So we know that at least at some stage that could be very beneficial for cats. In other studies, phosphate binders, even with a normal diet, could reduce PTH and serum phosphate. And there are multiple clinical studies with renal diets that are reduced in phosphate as well as other nutrients, with or without phosphate binders, showed clinical benefits. The IRIS guideline doesn't specify a dietary phosphate level, but rather guidelines are to keep the serum phosphate in the low normal range. This would be achieved using lower phosphate diets and phosphate binders as needed. Our next nutrient of interest is protein. There's much more information about protein in other species, specifically rats and humans and dogs. And in these species, high protein intake is suggested to cause or worsen chronic kidney disease. But the studies that show that did not necessarily take into account confounding variables, such as phosphate, calories, and acid base. Protein, especially animal protein sources, are a really good source of phosphorus and also have acid metabolites, and those can give you perhaps misleading information. There's been one study in dogs that was actually wonderful. It was a study to compare or separate the effects of protein from phosphorus. That study compared 16% protein versus 32%, and phosphorus at 1.4 or 0.4, all on a dry matter basis. And what they found in that 2-year study in dogs is that low phosphorus was definitely beneficial. And you look at this graph here, the yellow line at the top is the low phosphorus survival. The red line at the bottom is the high phosphorus survival. And you can see that phosphorus was much less in dogs fed the high phosphate diet. But the blue and the green lines that crisscross one another are the high versus the low protein, confirming that protein had absolutely no impact on survival in these dogs. Now, there's a different type of kidney disease that occurs in dogs that does not occur in cats, and that's an X-linked or hereditary glomerular disease, where these puppies will develop proteinuria early on, and that contributes to early chronic kidney disease. In those dogs, protein restriction was beneficial at reducing proteinuria, but that's because of the glomerular disease, and cats do not have glomerular disease. At least the vast majority do not. What about the studies of protein in cats? Well, there's really only two that look specifically at protein. And the first of those I'm going to share with you compared 52 versus 28% protein, and it was a 1-year study. The problem from this study is the cats fed the high protein diet. Many of them developed hypokalemia or low potassium because the high protein diet did not have enough potassium in it. Well, they recognized this after 3 months, and they corrected the diet by adding more potassium and continued the study for the rest of the year. Well, at the end of the year, cats fed the high protein diet had greater renal pathology. Their BUN or serum urea nitrogen was higher, and they did have higher urine protein creatinine ratios compared to the cats fed the lower protein diet. However, if we look at this graph, it shows the urine protein creatinine at different periods of the study, 3, 6, 9, and 12 months. The red bar represents the high protein fed cats, and the black bar, the low protein fed cats. So you can see that throughout, urine protein creatinine was higher in the high protein fed cats, but you can also see that the primary effect happened in the first 3 months while the cats were hypokalemic. And once the potassium was corrected, we actually see the urine protein creatinine decrease. Maybe not all the way back to normal or all the way back to the low protein level, but it comes down dramatically without changing protein intake, just by correcting the potassium deficiency. So it's hard to say that that urine protein creatinine is due to the protein intake. Further, these investigators noted that the high protein fed cats had lower serum creatinine, better GFRs, and better body weight. So another study was done to kind of look beyond the confounding factors of the first study. So it had the same levels of protein. It had adequate potassium in all the diets, but they fed it at different calorie levels, 75 versus 56 kcals per kilogram. And this is because in other species, calorie intake actually has an impact, with lower calorie intake being beneficial toward the kidneys. And in most experimental studies, animals fed the low protein diets consumed fewer calories as well. And so in this study in cats, again, there was no effect of protein, but the cats fed the higher calorie intake showed greater renal pathology. So these two studies together suggest that protein restriction in cats with chronic kidney disease may not be necessary at all. Now, again, clinical trials using renal diets did show a benefit, but these diets also are restricted in phosphorus and other nutrient modifications. Now, let's talk about proteinuria in cats for a moment, because it's true that an increased urine protein creatinine is a negative prognostic factor, but it may just indicate more advanced disease. We can see on the graph here that as urine protein creatinine increased in these cats, it was associated with a lower survival. But as I mentioned earlier, cats don't normally have glomerular disease, so many cats don't have an elevated urine protein creatinine, and those that do, it may be advanced disease with secondary glomerular damage. Do we need to treat it? Perhaps, Because proteinuria is a negative prognostic indicator, it does tend to reflect glomerular disease, but again, that's not common in cats. But the key thing is that there's no evidence, and I say that with an asterisk, there's no evidence that restriction of dietary protein can reduce proteinuria. In several studies where protein differed in intake, there was no difference in proteinuria. The only exception to that was the Adams study that we talked about a moment ago, associated with the hypokalemia. So proteinuria probably needs to be addressed, but probably not by protein restriction. The next nutrient of concern is potassium. As we were just talking about, hypokalemia is a significant problem for cats. It's a common finding in cats with chronic kidney disease, and it can be contributed to through the kidney disease itself can cause wasting. Low diets that are low in potassium can be a problem. Metabolic acidosis, which is also common in kidney disease, and acidifying diets. All these can contribute to the loss of potassium. And hypokalemia, especially with acidosis, can actually induce renal disease or worsen existing renal disease. A number of studies done back in the late 1980s through the 1990s showed this, where feeding low potassium acidifying diets to normal healthy cats actually caused kidney damage. And then cats who have kidney damage can have excessive loss of urinary potassium, contributing to depletion. And as we just saw, the protein study, we saw significant adverse effects in the cats with the hypokalemia. That said, at this time, there's no evidence that supplementation of potassium above and beyond that is provided in an adequate diet in cats that have normal serum potassium, even with kidney disease, supplementation of more potassium is not recognized to be beneficial. So adequate, yes. Above and beyond, no evidence for that. Our next nutrient of concern is sodium. Sodium-restricted diets have been recommended for decades as a means to reduce primary or secondary hypertension. Now, we know that primary hypertension is not a common finding in dogs or cats, but it also turns out that neither cats nor dogs appear to be sodium sensitive relative to blood pressure. So even if they do have elevated blood pressure, sodium restriction does not appear to be beneficial. There's one epidemiology study that showed that higher sodium intake was actually associated with a lower risk of chronic kidney disease in cats. Now, that's an association, not a cause versus effect, but there's no evidence that that restricting sodium would be beneficial before cats who have kidney disease. What about after? Well, one of the things we have to consider is that low sodium intake stimulates the renin-angiotensin aldosterone system, the RAS system. Now, that is the normal metabolic and homeostatic process, but it can have some adverse effects, as we'll see in a moment. So there have been several studies on sodium and on the RAS system and on blood pressure in cats. A couple of studies looking at healthy aging cats fed either 0.4 or 1.4 sodium. There was no impact on blood pressure, but the lower sodium intake did increase the RAS system. Another study with healthy cats as well as cats with chronic kidney disease were fed lower sodium diets at 0.2, 0.4, and 0.8% of the diet dry matter. Again, no impact on blood pressure, but the lowest sodium diet caused a decrease in GFR, an increase in serum creatinine and BUN, greater loss of potassium and actually hypokalemia, and an increase in the RAS system. So what we know about the RAS system, especially related to chronic kidney disease, is that it tends to be increased early in kidney disease. It's stimulated by low sodium intake. It's also stimulated by metabolic acidosis. And the increase in RAS correlates with the severity of chronic kidney disease in cats. The RAS system promotes vasoconstriction. It can increase GFR, and it can contribute to proteinuria, which is the reason we tend to treat it in our clinical cases. But we treat it through the use of ACE inhibitors. So the inhibition can decrease fibrosis in rats with chronic kidney disease. It can slow progression of chronic kidney disease in humans. And in cats, ACE inhibitors, and specifically benazepril, decrease the urine protein creatinine ratio. It decreased serum creatinine, and it slowed progression of chronic kidney disease, especially increasing survival in cats that had initial elevations in their urine protein creatinine. So we want to address proteinuria, but probably not through protein restriction, but rather through management with an ACE inhibitor, as we're seeing here. Next nutrient of concern is alkalinizing buffers. We've talked about how metabolic acidosis is common, especially in advanced chronic kidney disease. And some of the clinical signs of metabolic acidosis: anorexia, nausea, vomiting, loss of weight and lean body mass, lethargy, muscle weakness, decreased bone calcification. You'll recognize these as non-specific signs that are also common in cats with chronic kidney disease, as we can see here, some of the same clinical signs. Now, are they related or caused by the kidney disease, or are they caused by the acidosis, or both? We don't necessarily know, because they tend to occur together. Now, what we know about alkalinizing buffers in other species is much greater. Most of the studies have looked at chronic kidney disease or metabolic acidosis in rats or in humans. And we know that metabolic acidosis stimulates the increase in PTH. It promotes insulin resistance, and it's associated with progression of chronic kidney disease. The metabolic acidosis has a negative impact on protein turnover and nutritional status, even within a serum pH or blood pH within the normal range. If it's on the more acidic side, it has an adverse effect on protein catabolism and nitrogen balance. So acidosis can increase protein catabolism, decrease protein synthesis, and have a negative impact on nitrogen and protein balance. And in these species, rats and humans, all of these problems were improved simply by the addition of bicarbonate. Now, do we know that that would happen in cats and dogs? No, because there are no studies in cats and dogs that just looked at alkalinizing buffers. That said, all the commercial renal diets are specifically formulated with buffering agents to help address metabolic acidosis. And currently, IRIS has not established any goals relative to serum bicarbonate for cats or dogs with chronic kidney disease. Our final nutrient of interest is the omega-3 fatty acids. We know that these fatty acids, and specifically the very long chain, the EPA and DHA, are associated with beneficial impacts on inflammation and changes in renal hemodynamics. We know this from other species, not cats, and only one study was done in dogs. In that dog study, 15% of the diet came from fish oil, and that's a massive amount of fish oil for a diet. In that study, there was a beneficial effect in terms of glomerular hypertension and reduced progression of chronic kidney disease. No such study has been done in cats. However, there is a retrospective study of cats fed various commercial renal diets. And in that study, the best response was seen with the diet that had the highest EPA levels. So pretty weak evidence in cats, and yet there is evidence in multiple species in terms of the anti-inflammatory properties and enhancement on blood flow. So in summary of the key nutrients that we've talked about, quite a few nutrients are suggested. Are they beneficial in chronic kidney disease? Phosphorus restriction, yes, I think without question, the evidence supports it, as well as extrapolation from other species. Phosphorus restriction, and probably early on in chronic kidney disease. Protein restriction, unlikely to be beneficial in cats, especially early on. Perhaps in very late stage, cats that might become uremic, there may be a benefit to protein restriction at that stage, but there's no evidence one way or the other. Sodium restriction does not appear to be beneficial at any stage. Potassium supplementation is important to correct and avoid deficiency. Above and beyond that, probably not additional supplementation. EPA, DHA, the omega-3 fatty acids, antioxidants, and alkalinizing buffers are all likely to be of benefit for cats with chronic kidney disease, but at this point in time, those benefits are unproven. Now, I want to come back to the whole cat for a minute. We talked already about how cats with kidney disease tend to have tubular interstitial fibrosis and not glomerular disease, so probably not so much benefit from protein restriction. It's typically slow progression, which means that cats will live potentially many years with their condition, and it's common in older cats. So we want to think about a little bit more than just the kidneys. We want to feed the cat, not just the kidneys. So we need to take into consideration the unique needs of senior cats. And those include the fact that many senior cats are losing weight. This graph is a cross-sectional study of thousands of cats seen at primary care practices. And you can see the percentage of cats that are underweight dramatically increases in cats beyond 12 years of age. And so we know that older cats tend to lose body weight. We also know that they tend to lose lean body mass. We need to make sure we're providing them with adequate protein and calories and other nutrients. This is data from cats that died for various reasons in a research colony. And they died from cancer, they died from renal disease, they died from thyroid disease and other causes as well. What you can see from that graph, this is looking at their body weight backwards from point of death. And they all started losing weight about 2 to 2.5 years before the terminal event. This is data from pet cats with chronic kidney disease. And very similarly, weight loss started up to 3 years before the cats were diagnosed with kidney disease and then got worse after they were diagnosed. So weight loss in both healthy cats, in cats with subclinical disease and cats with chronic kidney disease, weight loss is very common. And what we can see, the graph on the left is early stage, the graph on the right is late stage, and the curves look very similar. But if you look very closely, you can see that the absolute weight is a little bit lower already for cats in stage 3 and 4. So the implications of this is that weight loss is common in geriatric cats. It may be an early indicator of subclinical disease, so it should be a red flag to look for what might be causing the weight loss. And we should look at weight in cats on a percentage basis, because if a cat loses a fraction of a kilogram, that may not sound like much. But for a cat, that could be 5, 10, 15% of its body weight, which does sound like a lot and should be investigated. But it raises another question, and that's, can maintaining weight delay morbidity and mortality in these cats? Well, there's not much evidence to address that question, but there was one study done by my colleague Carolyn Cupp. And this was a study that started with 90 healthy aging cats and followed them over about 7 or more years from the beginning of the study until they died from natural causes in old age. What was found in that study is that there was a significant relationship between maintaining body weight, lean body mass, and body fat versus survival. So there was a 64% increased survival for each 1 kilogram increase in body weight in cats at or below ideal body condition. There was a 12% increase in survival for every 1% increase in percent body fat, and a 20% increase in survival for each 100 gram increase in lean body mass. So this suggests if we can keep cats from losing weight or slow down their loss of lean body mass, it could have beneficial impact on survival. So I want to mention briefly sarcopenia. Now, sarcopenia is an age-related loss of lean and muscle mass that's unrelated to disease. It's different from cachexia. It's just a loss of lean body mass. It occurs in every species studied, including humans, including dogs, and yes, including cats. This is looking at the lean body mass in basically healthy cats over different age groups. And you can see there's a dramatic decrease in lean body mass in aging cats starting at about 11, 12 years of age. And just it can drop as much as 30%, even in healthy cats. So we would like to try to prevent that as much as possible. And here we have some data on those unique needs of cats. They lose weight, but they also have an increase in energy requirement. If we look at the energy needed to maintain body weight in geriatric cats, it increases about 25% on average between a 10-year-old cat and a 15-year-old cat. Part of this might be related to the fact that these older cats, many of them have reduced digestive function, reduced ability to digest fat, reduced ability to digest protein. And those that have reduced ability to digest fat also show some evidence of reduced uptake of micronutrients such as B vitamins and fat-soluble vitamins and electrolytes and so forth. So we need to compensate for that through highly digestible diets. And then finally, these senior cats actually have increased protein needs compared to younger cats in order to maintain lean body mass or reduce sarcopenia. So cats need about 3 times more protein to maintain lean body mass versus that which is needed just to maintain nitrogen balance. It turns out that cats need about 34% of their calories for protein, and this is adult cats. Geriatric cats may need even more. So if we talk about nutrition for aging and geriatric cats, many geriatric cats are losing weight and losing lean body mass. They may have reduced digestive function. Many kidney disease cats are geriatric, are losing weight and lean body mass. And remember, they can live for years with their chronic kidney disease. So we need to feed the cat, not just the kidneys. We want to do everything we can to maintain weight and lean body mass, get enough calories into these cats, get enough protein into these cats, provide complete and balanced nutrition, and then address the changes induced by chronic kidney disease. The key nutrients that are reasonably well supported with evidence are phosphorus control. Early stage chronic kidney disease, we want to start already thinking about restricting phosphorus. We want to make sure there's adequate potassium intake, adequate calories, adequate protein, and feeding these cats with an alkalinizing food. We don't want to even think about restricting protein early on. Possibly in late stage kidney disease, there may be a benefit. In late stage, we may need to restrict phosphorus more than in early, but our goal is to control the homeostasis of phosphorus and keep it from getting out of hand. So thank you very much, and I appreciate your attention today.